We talk a lot about healthcare up in this joint because that's one of our big three: healthcare, education, the cost of living, and they all roll into one. And I just wanted to remind you where we stand with healthcare. I'm going to tell you what's going on, why it's happening, what Andy Harris is doing, which you can probably guess, and what we plan on doing about it. So, as you can see, 175,000 Marylanders are about to lose their health care coverage this year because of that big, ugly ass, nasty bill that was signed into effect on July 4th. And I say all of us for all of us because you may say, well, Medicaid don't affect me. I got private insurance. I'm about to tell you why it does. So, state health officials have said over and over again, all of this stuff, people losing Medicaid because maybe they don't work 80 hours a week, the 1.02 trillion dollars pulled from Medicaid, the 2.7 billion dollars a year in federal healthcare funding disappearing from Maryland, all of that will jeopardize the financial stability of our entire health care system. This will lead to more than 1,400 extra deaths this year nationwide. This is, hey, one death is too many because of this. People will choose not to get insurance, and people will just not be able to go to the doctor's office. And I know a lot of people like to say, well, they can just bill them. Well, that causes so many jams in the system that it's going to make it bad for the people, for everybody in their health care. Oh, man. So let's talk about your boy, Andy Harris. So Andy has done the absolute least that he possibly can. We're at risk because most of us in Maryland's first district are in rural counties, the entire Eastern Shore. And Andy voted present with the big, ugly, nasty ass bill. That doesn't mean that he was a good guy. No. When congressional people, when congressmen and women vote present, that means they usually do that because they want to vote with their party, but they also don't want to take any accountability later for voting the same way as their party. So in this case, Andy technically voted yes, but he didn't want y'all to know that that's what he was doing. Isn't it a shame? He's a congressman here in Maryland's first district. He sees us sitting here with horrible healthcare access, and he won't take a stand for us at all. He's taking that corporate PAC money while you suffer, while you have to wait hours in an ER. He listen, the system was broken before he voted present, right? We can name Hartford Memorial Hospital, Shore Medical Center at Dorchester, Chestertown, the Upper Shore Community Mental Health Center. Man, Somerset County is actually a maternity care desert. That's for real. Yeah. So these things were happening and he hasn't done anything about it yet. Now, the one thing I think he does support, we can put this, I want to tell you about U.S. Acute Care Systems. Now, they run ER staffing at 26 Maryland healthcare facilities, including right here on the Eastern Shore. And this is one of those companies that's backed by Apollo Global Management. This is a private equity firm, and what private equity firms are doing to hospitals is disgusting. So they're treating it like a business, not as a hospital. They don't know anything about healthcare. They don't care about how people feel. They don't care about helping the people. What they do is they extract money from hospitals, then they let them fail. They treat it like a startup. A woman in Pennsylvania showed up to a hospital with a barely breathing baby, and the hospital was closed, because that's what hospitals do. It's really strange. So what we plan to do is the exact opposite. I know it doesn't take much to beat Andy Harris when it comes to doing stuff for Maryland One, but for us, one, we do want to fight back on the private equity firms. We got to make sure we hold them accountable for making sure they take care of our people. We make this district attractive to specialists. We don't want maternal healthcare deserts in Somerset County. We want them to be able to get all the healthcare they need right then and there. I've watched ambulances drive from Crisfield to Salisbury. You don't know if someone's going to make it. That ends now. We go big and we go hard for making sure we can get some access to proper healthcare throughout this entire district. You ready for that? And we fight back and protect Medicaid. And we want that Medicaid expansion. We bring back that federal funding as much as we possibly can. And I promise you, I'll fight hard from you. I'm someone who's had to have my kids on Medicaid so that they can have all the proper health care they possibly need. We're going to hold a lot of these corporate companies accountable too for getting the kickbacks from the state and federal funding for having people not earning a living wage. So that's who we need to hold accountable. These corporations like Walmart. That's exactly what we're going to do. What do you think of Andy Harris's present vote? What do you think of making sure we take care of all of us for all of us? We got a lot of stuff that we can say we want healthcare to be in this country because it does need to improve massively. But we got to take care of our people right now as well. I want to hear from you. Let me know exactly what you think right here in Maryland One.